Hello AP students, this is Mrs. Politsky, and I have notes for Chapter 12, Psychological Disorder, and we're going to talk about somatoform disorders. Somatoform disorders are psychological problems appearing in the form of bodily symptoms or physical complaints such as weakness or excessive worry about disease. The somatoform disorder includes conversion disorders and also hypochondrias. Somatoform disorders are not especially common. They occur in only about 2% of the population. So examples of this would be conversion disorder, hypochondria, some pain disorders, and so forth. So, conversion disorders. This is a type of somatoform disorder marked by paralysis or weakness or loss of sensation, but there is no discernible physical cause. So an individual might become very weak, but physically, if you look at the biological side of things, there's nothing amiss in the body. Formerly, this was called at one time hysteria. Patients with this diagnosis may, for example, be blind, deaf, unable to walk, or insensitive to touch in parts of the body, and yet they have no organic disease that shows up on any neurological examination, lab test, or x-ray. The tip-off to the problem is probably psychogenetic or genic. No physical symptoms. It comes from a pattern of the patient's symptoms. They do not match any possible pattern of nerve impairment. Conversion disorders were much more commoner a century ago, particularly in Europe and the United States. Even Adolf Hitler suffered from hysteria at one point in his life. Hypochondria. This is a somatoform disorder involving excessive concern about health and disease, sometimes known as hypochondria. Sufferers worry about getting sick. Every ache, any pain signal in their mind is a disease. They have an exaggerated concern about every illness that leads the sufferer to bounce from doctor to doctor until they find one who will listen to their complaints and prescribe some sort of treatment, such as minor tranquilizers or placebos. Thank you very much.